Thank you, Madam Chair, and I'm going to make a few extemporaneous remarks before I get to my prepared remarks. First, I just want to really thank you for holding this hearing. I think it's a very important hearing to have, and I want to thank all of my colleagues that were able to make the trip here. We all understand why others couldn't, but I really appreciate each of you on both sides of the aisle for coming. And I want the record to show I joined the chairman in urging that Dr. Fauci be allowed to testify here. I think it would have been good testimony, useful to this committee, I think useful to this country. Frankly, I think going forward, this subcommittee, probably more than any other, is going to need administration input, expert input, as we make the important decisions in front of us. And while I'm not naive enough to believe that there's not a certain amount of partisanship on Capitol Hill, and some committees are more partisan than others, frankly, the Appropriations Committee in general, and particularly this subcommittee, are not hyper-partisan committees in my view, and the record shows it. In the last 5 years, working together on this subcommittee and with our friends in the United States Senate, particularly Senator Blunt and Senator Murray, we've increased NIH funding by 39%. We've increased CDC funding by 24%. We've increased the strategic stockpile funding by 34%. We've established the Infectious Disease Rapid Response Fund. I think that's a bipartisan record of accomplishment to be proud of, and I think in retrospect we all wish we had done more, but the reality is we are so much better off where we're at because of the actions taken in a bipartisan sense by this committee. So its record shows that it knows how to work together. I just note for the record, my friend the chairman, when I was chairman, voted for final passage of the bill every single time. We negotiated, got to a place where we could agree, and she helped me get it across. I was able to do the same thing with her when she was last year assumed the chairmanship, and I hope that's the way we can continue to work going forward. So, again, I think we're going to be called upon to make some really important decisions. And having read the testimony of both Dr. Rivers and Dr. Frieden, a lot of that is going to call for sustained investment in the public health sector. Frankly, I think it's going to call for us looking at the CAPS agreements on some of these accounts as well. I don't think you can probably get to where we need to go within the cap. So we need the input, which I know our two witnesses here today will give us. And again, I look forward to working with every member of this committee, and particularly with you, Madam Chair, to arrive at the right decision for all our country going forward. So with that, again, I want to thank you, too, for the many calls and briefings that you've held over the past few weeks to keep all of us updated on efforts to overcome this pandemic. Over the last several weeks, the spread of COVID-19 has caused unthinkable disruptions to life as usual, and it will continue to do so for some time, even as we flatten the curve. Following the unprecedented strain on our healthcare systems and the devastating economic hits to hardworking Americans as a direct result of this coronavirus, desire for normalcy to return is certainly a sentiment shared by us all. But as state and local economies slowly and cautiously begin to reopen, it's important to remember that getting back to business does not yet mean getting back to normal. Even though the fight against COVID-19 is far from over, keeping businesses closed and workers at home is not a sustainable option for the long term. While the federal government has provided some short-term relief to help individuals, households, businesses, and communities stay afloat during this period of extreme social distancing, our economies need to get moving again, and Americans need to get back to work. However, any such efforts to reopen must continue to keep the health and safety of Americans at the top of mind and not undo previous progress in slowing the spread of coronavirus. This will indeed be a balancing act. Until there are working treatments, effective therapeutics, and ultimately a vaccine to control COVID-19, the risk and the danger for disease remains. Returning to more regular functions and operations requires gradual action completed in phases and based on data. President Trump and the Coronavirus Task Force recently recommended criteria for states and communities to achieve before moving into phases of reopening. This includes a consistent downward trend in reported symptoms, consistent downward trend in documented cases, or positive tests, as well as hospitals being able to treat all patients without crisis care, and robust testing in place for all at-risk healthcare workers. While this is a helpful reopening blueprint, states are not strictly bound to it. Indeed, just as there are 50 separate and unique states, there may be, 50 different approaches to reopening that carry the same spirit of caution and decision-making based on sound data. However, the idea behind these three phases is to gradually allow businesses and workplaces to open back up, but not immediately at full speed ahead or without adaptations to prevent crowded environments. In the earliest phases, this may include limiting the number of employees inside of workplaces, continuing telework practices, vulnerable and other older Americans remaining at home, or limiting the number of customers inside retail stores and restaurants. Clearly, life is going to be different going forward for a while than it was in our immediate past. Regardless of the phase of reopening in our communities, we must remember not to abandon practical and hygienic precautions like thoroughly and frequently washing hands, not touching our faces, daily disinfecting of surfaces, keeping a safe distance from others, and staying at home when you're sick. Finally, it's critically important that the federal government learns from this crisis and actively prepares to face down another pandemic in the future. While I'm proud that Congress has generously invested in worthy tools and response resources to strengthen our readiness in recent years, it must be an even higher priority in the days to come. Though the United States was as prepared as any country to face the emergency, you can never be fully prepared for what you don't know is coming. In this case, a mysterious and deadly virus originating in China, only identified early this year, and for which a vaccine does not yet exist. I look forward to hearing more recommendations from our witness, Madam Chair, this morning, and I yield back the balance of my time.